We're joined now by Dr. Adam Hamawy. He's a plastic and combat trauma surgeon who volunteered with the Palestinian American Medical Association to provide critical medical care in Gaza. Doctor, welcome to the program. You were also a combat surgeon at the height of the war in Iraq. How does what you experienced there compare to what you saw in Gaza and what is playing out right now?
Hello, and thank you very much for having me. The difference between that war and this is that was a war, and there was unfortunately civilians caught in a crossfire like everywhere else. Never a good thing. This is truly a genocide. We've been seeing people, families, children, civilians being targeted and killed since the beginning of war, and now we're, in addition to seeing the bombs, we're also seeing starvation and people dying from lack of food and medicine on a daily basis. And this is done with purpose, and it is not being stopped. I mean, this is like, there's overwhelming evidence about what's happening, and this is not collateral damage. This is not people that are incidentally hit. These are not human shields. These are targets by Israel, and it is a genocide. That is the difference.
And you've appeared before the U.S. Congress telling them about the challenges that aid workers are facing, what you yourself saw, and also explaining the humanitarian crisis. Do you feel those efforts have fallen on deaf ears, given the deadly, chaotic aid delivery that we're currently seeing?
It's really disappointing and unfortunate that, this continues to be the case. I mean, no one at this point can claim ignorance about what's happening. Congress has been briefed. The administration knows what's occurring. They've been there on the ground. It is clear that the United States is aiding Israel in what is occurring and is, basically complicit in the genocide as well. And unfortunately, the United Nations also has failed, where it's supposed to be entering and basically intervening in this situation. It unfortunately has a member of the Security Council, one of the permanent members, that's actually facilitating this genocide. So what do we do now? There seems to be no solution to what's going on, and it's just very, it's very disappointing to see.
It certainly is, especially when you hear from medical professionals who are still working there or who have volunteered and come back, saying that some of the injuries that they are now seeing are even worse than when they were there a year ago, talking about injuries from shrapnel. And as somebody who has been in the field, just talk us through that, because what do those injuries tell us about the weapons that Israel is now using against Palestinians?
So the attacks have been steadily being escalating as time goes on. From regular, from basically, bombing in the beginning and some missiles that were, targeting neighborhoods. It seems that the munitions that are being used, the type of weapons, the intensity of the attacks increase with every month as, basically Israel does what it wants without any consequences. So it seems to be testing the boundaries and pushing the boundaries on a daily and monthly basis. And until they're told to stop, they're going to be using everything they have. So we see the blast radiuses of the bombs increasing. We see the number of casualties that are coming in from being just those targeted into the homes to neighborhoods, and even extending beyond that now with the shrapnel, basically, the basically the bariatric, the barometric pressure from these bombs extending sometimes over 500 meters from where the center of the blast radius is. So, we're just seeing just more and more mass casualties, more people coming in, more children getting hurt since they're the most vulnerable, and in addition to that, they're, without the food or medicine, we can't really treat them anymore. I mean, it's just it's just getting worse rather than better.
And you say you can't treat them anymore. What can you do for people? Because, of course, the aid is not being delivered, so there aren't enough medical supplies. But incredible the job that medical professionals are still doing or trying to make it as easy as possible, especially for the children. But how do you actually function in that type of situation, just on a professional as well as a personal level, because so many of the Palestinian doctors are, of course, living through this themselves and have lost family members as well?
You know, it's working with your hands tied behind your back. It's basically going to families and telling them that you can't really save their child or save their loved ones. It's holding people's hand in their last moments of their life. It's operating knowing that you'll maybe extend their life by a few hours or a few days, but without relief in sight. You know, things that we normally could treat here in the United States and really anywhere in the world with basic medications, with basic, you know, surgical techniques, knowing that that isn't available. And hopefully if we buy a few days, then some relief will come in sight. But it seems to be futile. But that's, you know, the Palestinians who are living through this every day, the doctors, it's, you know, I think that they've basically losing hope that anyone is going to intervene. And for those of us that just go and spend a few weeks, it's unbelievable how this could be occurring every single day. And when we come home, we come home with the guilt that we are leaving people behind to do this without us, and the guilt with coming to, you know, the United States, where we are actively supporting this genocide and providing the money and the bombs for this to occur on a daily basis. And again, to have the U.S. go in front of the world today and veto a ceasefire, which is basically stopping the bombing and allowing food, medicine, and water to come in, is just, it's unbelievable. I mean, like, how could someone deny this from happening? And the excuse that this is in defense of Israel, there's no defense here. This is not about defense. This is about the destruction of a people. It's about genocide. It is about, you know, uncensored, unlimited violence that has been scaling up, like I said, over the last few months without any, you know, without any intervention, without any censure, without any consequences. And until there are consequences, this isn't going to stop.
We're going to have to leave it there. But Dr. Adam Hamawy, thank you so much for speaking to us. Really appreciate your time.